Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on VHHA.com and on popular podcast hosting apps including Apple Podcast, Amazon, Spotify, and many others. We're a member of the Public Health Podcast Network, Virginia Audio Collective, and the Family Podcast Network. Podcast episodes also air each Sunday at 9 a.m. on 100.5 FM, 92.7 FM, and 8:20 a.m. across Central Virginia, 1650 a.m. in Hampton Roads, 105.1 FM and 1050 a.m. in Lynchburg, and Wednesdays at 1 p.m. on 93.9 FM in Richmond. Please send questions, comments, feedback, or guest suggestions to pcfpodcast@vhha.com. That's pcfpodcast@vhha.com. Today, we're pleased to be joined by Dr. Aamir Kahn, the Medical Director of VCU Health Hume Lee Transplant Center's islet cell transplant program, for a conversation about his work, the Hume Lee Transplant Center, and more. So welcome to the show, Dr. Kahn. Thanks for being with us.
Thanks for having me.
It's our custom to start each episode by getting to know our guests better. As we mentioned, you currently serve as the Medical Director of VCU Health Hume Lee Transplant Center's islet cell transplant program. You're also an assistant professor at the VCU School of Medicine. You attended medical school in India and fellowship and residency at academic medical centers in Virginia and Iowa. Beyond those few professional details, please tell us some of the essential things about your unique personal story.
Yeah, so I'm an abdominal transplant surgeon, which is like the core part of what I do every day. But besides that, I'm also a hepatopancreatobiliary surgeon, and I do total pancreatectomies and islet cell transplant as part of that. And so that's pretty much what I do.
So your specialty is in the area of solid organ transplants for liver, kidney, and pancreatic patients. Many of your patients are adults who have been diagnosed with end-stage liver disease, kidney failure, and liver tumors. Other patients need vascular access for dialysis. As a baseline for this conversation, tell us about the patient population you work with, the conditions that require them to seek medical attention, and the considerations that are part of the organ transplant process.
A vast majority of our patients are dealing with end-stage organ disease, particularly like end-stage liver disease, end-stage kidney disease, pancreatic disease like diabetes, as well as what I particularly also do is islet cell transplant for chronic pancreatitis, which is essentially an end-stage disease for pancreas also. We're basically dealing with end-stage disease.
You also work with patients experiencing chronic pancreatitis, which is a progressive inflammatory disease that affects how the pancreas regulates blood, sugar, and helps the body digest food. Experts say the condition causes about 86,000 hospital stays in the U.S. each year. There are strategies to manage that condition with medication, as well as surgical approaches, which we'll discuss in a moment. For the benefit of our listeners, can you provide some insight on the condition of chronic pancreatitis and its root causes?
Yeah, absolutely. Chronic pancreatitis, so it is a chronically morbid and debilitating condition that is often associated with chronic abdominal pain, pain medication, narcotic addiction, multiple hospitalizations, and all of these significantly affect their quality of life. So overall, the chronic pancreatitis is basically a disease where the pancreas has had inflammatory changes as well as scarring, which leads eventually to this chronic, painful, debilitating condition, which at the end leads to what we call exocrine pancreatic insufficiency, which is actually a person's inability to digest food, and they lose all the important vitamins, nutrients, and as the disease keeps progressing, it also affects what we call islet cells, which are responsible for maintaining blood glucose levels in the body. So eventually patients even become diabetics as a result of that.
And so we noted that you are the director of the islet cell transplant program for the VCU Hume Lee Transplant Center, which is a national leader in liver, kidney, and pancreas transplants for adult and children. Earlier this year, the Transplant Center completed its 100th rare procedure to treat chronic pancreatitis. That procedure is total pancreatectomy with islet cell autotransplantation, or TP-IAT. It's my understanding that the VCU Health Hume Lee Transplant Center is one of the few centers in the nation to offer it. If you would, tell us about this procedure and how it works.
So it's a procedure that is done for patients who have had severely poor quality of life affected as a result of chronic pancreatitis. And it involves removal of the entire pancreas along with a few other associated tissues and organs around the pancreas, mainly because the pancreas is a central organ in the abdomen and it shares some its blood supply with other organs. So usually it also involves taking out a part of the stomach, spleen, and a part of the small intestine called duodenum, which is attached to the pancreas. So those all come out, and after this, reconstruct the small bowel, resume the continuity of the bowel. And then what we have here at VCU is a unique ability to extract these islet cells from the pancreas, which are responsible for producing insulin and glucagon, and these hormones maintain the blood glucose levels in patients. So that unique ability gives us the advantage of preventing what's called a brittle diabetes, what would happen if we were not being able to give them islet cells back. It's a very unique operation. Very few centers in the world are able to do it. Only centers which have ability to isolate islet cells from the pancreas are able to do it. Even in US, we have about 15 to 20 centers able to do it.
So robotic surgery is an area of specializing for you, and I've read that you are part of a clinical trial investigating a new technology that could better preserve organs, potentially expanding the availability of organs. Looking ahead, what are some developments on the horizon related to the islet cell transplant program and your field of specialty that may yield greater advances in patient care?
Yeah, so even in the islet cell world, the robotic surgery is an important new advancement that's happening, which is kind of changing this frontier into a minimally invasive surgery. And we being kind of the leaders in robotic surgery, we are also trying to expand that.
So thank you so much again for being with us today, Dr. Kahn. Before we let you go, we do have a tradition on the Patients Come First podcast to ask our guests a pair of fun personal questions. To keep things interesting, we have a list of 10 mystery questions. So why don't you choose two numbers between 1 and 10?
Yeah, sure. How about 3 and 5?
All right. Number 3. What is the best piece of advice you ever received and why does it stick with you?
The best piece of advice I received was from my mentors, who once told me that every time you do something in surgery, always think about what you would want somebody else to do for your loved ones. So that's kind of the motto that I have, and that's what I always try to think when I'm seeing my patients is this is what I would want, somebody to do for me or for my loved ones. So I should give them exactly the same kind of treatment.
Sure. I really love that advice. I think that's great. And number 5, if you could spend the day with one person from history, living or otherwise, who would it be and why?
That would be a tough one.
Mm-hmm.
It would be my wife or my kids, because that's the only life, that's my only other life where I feel like extreme solace and peace, spending time with family.
Sure. I love that answer. And that will bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so you know when new episodes are released. And we want to once again thank our guest, Dr. Aamir Kahn, for joining us today. So thank you.